Hello, ma'am. Am I audible? Yes, thank you everyone present here. I'm very glad to be a part of this international conference. So today I'm going to share the knowledge about prescription, how a nurse prescriber can prescribe, the principles, the competencies, and the factors that is influencing during prescribing, and also the steps of prescription. So before going to our slide, let us think how the health sector in India from the present situation is facing. So the health sector, the health system that is in India, by WHO 2021, they have given a brief outline that on average, the doctors who are serving in the government sectors, they almost serve more than 11,000 population. So that is 10 times more compared to the ratio that is given by WHO, that is 1 is to 1,000. So after knowing the context of the human resources, the main focus is the nurses. The nurses can also overcome and also supply the medicines in some countries. They have already legalized, they have already empowered, like in UK, in Australia, and in United States. But as we know, in India, there is not legally empowered, but by this INC, India Nursing Council, and Government of India, they have already suggested the module in this INC curriculum. So, as a nurse practitioner, the nurse, how they can prescribe. According to that, we are going to see some principles of prescribing and competencies that can identify the factors and also steps of prescribing. So let us see one by one the principles of prescribing. So as a nurse practitioner, before going to the main section of principles, who are the nurse practitioners? That we should. Am I audible? Can you respond? Am I audible? Yes, ma'am. Okay, thank you. So we have known about the nurse practitioner and the nurse prescriber. So let's go to the principles. So in every procedure, we are bounded with some rules. That is fundamental truth. So here, according to the Oxford Dictionary, they have also given the principle definition as the fundamental truth or the rule that forms the basis of system of belief, behavior, or scientific law. So here, by the British Pharmacological Society, they have given the 10 best prescribing principles. We will discuss them one by one. Please change the slide. So according to the British Pharmacological Society, as we as a nurse, nurse trainer, nurse trainee, we know that how medicine are helpful to prevent and also to alleviate the symptoms. So we know that medicine have both sides, that is the benefit and also the harm. So if we are giving medicine in the wrong way, that will be harm. That is used in the inappropriate. Both the medicines have both the capacity of help and also the capacity of harming if used inappropriately. To prevent from such kinds of harm, the British 10 principles of good prescribing are given in the next slide. So we observe the principles one by one. Number one principle, change the slide please. So the first principle that is given according to the British Pharmaceutical Society, that is be clear about the reason of prescribing. हम क्यों ये मेडिसिन को प्रेस्क्राइब करेंगे? What is the rationale? उससे जो आया हुआ है एक पर्सन आपके पास कंप्लेंट लेकर कि ये प्रॉब्लम हो रहा है तो उसमें आपको कौन सा मेडिसिन देने में इफेक्टिव रहेगा so you should be very clear about the rationale of giving that for prescribing the medicine. So establish an accurate diagnosis क्योंकि before giving any kind of medication first thing is we have to be very clear about the diagnosis. Important. And suppose if that is not very fastly, we have to do the treatment. We have to go through the harm and also benefit of that medicine. तो मैं दोनों मिक्स में बात कर लेती हूँ हिंदी and English.
Recording in progress.
So be clear what way you are going to prescribe medicine, whether what benefit the medicine will and what harm the medicine will be given the person. So first principle is be clear about the reason of prescribing. Next slide please. Then second principle is medication history. The medication every time while the person comes to you, we are taking the proper history. So here before prescribing, medication history is also important principle. क्यों मेडिसिन हिस्ट्री क्यों लेना है वेदर वो पर्सन पर्टिकुलरली कोई ओवर द काउंटर मेडिकेशन उसका चल रहा है या उसका कोई ड्रग का साइड इफेक्ट हुआ है प्रीवियसली या कोई एलर्जी है पर्टिकुलर ड्रग्स में दिस होल हिस्ट्री शुड बी टेकन सो दैट इंफॉर्मेशन जो है वो प्रॉपर रहे एंड you can take the information from the patient itself if he or she is oriented and otherwise from the caregiver or from the other medical practice. So second principle is the patient medication. Then the third principle that is given by the British Society, that is we should go for the other factors, the individual factors. मीन्स इंडिविजुअल फैक्टर्स में बहुत सारा है जैसे कि जेनेटिकली फिजियोलॉजिकल फंक्शंस लाइक एजिंग प्रोसेस और अदरवाइज the woman may be pregnant so during the pregnancy there are a lot of changes in the system and also lactating mother or otherwise वो person के पास कोई पुराना बीमारी है कि नहीं the vital organ like kidney liver lungs all this be considered as that factors we have to take from the person that से आप description करेंगे that the benefit or harm for the treatment. Then number fourth principle is the patient ID. Every time हम लोग patient centered care करते हैं, so we have to involve the patient in the decision making. जैसे regarding the drug, we have to give the proper information. We should take the account of the patient ideas, concerns, and also the expectation. तो ये चीजें भी ध्यान में रखना है कि वो विलिंग है कि नहीं और उसका क्या एक्सपेक्टेशन है ये मेडिसिन देने के बाद. तो द पार्टनरशिप, दोनों के बीच में एक पार्टनरशिप होना चाहिए बिटवीन द टू पार्टीज, द पेशेंट पार्टीज एंड द मेडिकल प्रोवाइडर. तो इससे क्या होगा, द इफेक्टिव वे ऑफ मेडिकेशन प्रिस्क्रिप्शन में डाल सकते हैं. Then number 5th principle is that is select effective, cost effective and safe way of medication. तो ये भी important क्यों है, क्योंकि in our developing country like India, the cost effectiveness very important concept. क्योंकि जहाँ पे हम मेडिसिन देने वाला है, whether the medicine का उसका cost कैसा है, वो कहाँ तक पर्सन को इफेक्टिव रहेगा एंड सेफ साइड पे है. तो यहाँ पे देयर आर टू प्रिंसिपल्स, दैट इज द बेनिफिट हार्म बैलेंस एंड रिस्क बैलेंस. ये दोनों को देखकर ही मेडिकेशन प्रिस्क्रिप्शन में जाना है. नेक्स्ट स्टेप, जैसे कि ये मेडिकेशन देगा तो उसका बेनिफिट के साथ साथ उसका साइड इफेक्ट कौन सा ज्यादा ठीक रहेगा, whether the benefit will be more compared to the harmful. और दूसरा है रिस्क. अगर ये मेडिसिन हम नहीं देंगे तो नॉट ट्रीटिंग एंड ट्रीट दोनों में से अगर नहीं दिया तो उसका क्या हार्म होगा, देने के साथ भी क्या हार्म होगा. तो दोनों को बैलेंस करके जाना है. तो दैट इज विल सेलेक्ट द इफेक्टिव, सेफ एंड कोस्ट इफेक्टिव मेडिसिन. Next principle, that adhere to the national guidelines and the novel formulary where appropriate. हमेशा जब भी prescription करना है, we have to be aware of the respective duty. जहाँ पे उसका availability, जहाँ पे उसका cost कैसा है, and accessibility, कि whether that will be available. देखिए मैं आपको एक चीज बताती हूँ. मेरा का ट्रीटमेंट के लिए मैं बाहर लेकर गई थी, तो उधर जो बाहर जो मेडिकेशन जो प्रिस्क्राइब किया था, जब वो घर वापस चला गया तो वो मेडिकेशन उधर नहीं. तो the accessibility, the availability on that particular areas, that should be also considered, and the potential of the drugs that कहाँ तक ये effective होगा उसके लिए, both in the cost and also in the health. This be adhered to the national guidelines and local one. Then the 7th principle is writing unambiguous legal using the correct documentation. Very much important to prevent from the medication error. So in hospitals and in other sectors, medication errors are occurred because of the inappropriate handwriting, like in the doses, in the frequency, and also in the name of the medication. So these will be avoided and proper documentation so that there will not be any medication error in future. Then number 8 principle according to British Pharmacological Society, that is monitor the outcome. So अभी तो हमने medication finally patient के साथ partners से मिला के अच्छा communication करके everything we have done. Next step is the outcome of the treatment. We have to observe, monitor the outcome of the treatment, both beneficially and also the adverse reaction. It's very important. क्यों देने के बाद हमको देखना है कि उसी से उसको इम्प्रूवमेंट मिल रहा है या अदरवाइज उसके और हार्मफुल जगह पे जा रही है. So that outcomes be monitored. And the 9th principle, communicate and document prescribing decision and the reason for that. Communication कैसा, with the patient and also with your higher qualified person, supervisor. तो communication से कैसा रहेगा, all वो चाहिए regarding the timing of the medication, regarding the doses of the medication, that will be very proper in that way. So the communication is also one of the important factor in the important principles and in prescribing the medication. Then number 10 is last one, the we should never go beyond our knowledge. That is prescribed within the limitation of your knowledge, skills and experience. Why? क्यों? क्योंकि जहाँ पे मेरा नॉलेज नहीं है उसमें मैं बियॉन्ड दैट जाऊंगी तो इट विल बी हार्म. So the knowledge should be up to date. As a nurse practitioner, our knowledge should be up to date and also skills, and also we should know regarding the things. कि अगर मुझे ये समझ में नहीं आ रहा है तो I have to take the knowledge, sharing of the ideas with my authority or those who are qualified in such area. So prescribe within the limitation of your knowledge, skills and also experience, and every time we have to check the proper medication doses, proper treatment frequency. These all should be considered while prescribing and 10 principles already we have discussed about the rationale why you are giving the medication. Then you have to take the proper history. The factors should be involved. The partnership, the patient and the physician, the medical practitioner partnership should be there, and the medicine should be very cost effective. National guidelines have to be followed. Legal prescription is clear, and the legal documentation should be there. Monitor the outcome and communicate about the information, correct information of the medication, and also we should practice under our limitation, that is our skill, experience and knowledge. So here 10 principles that is given by the British Pharmacological Society. And now after knowing all the 10 principles, let's go to the nurse competence. And we know what is competence. Competency is one, the knowledge, आपके पास skill, knowledge और जो behavior जिसमें हम उस जगह पे उतर के काम कर सकते. Means the qualification, yeah, I am very competent about his practice. So जो भी nurse prescriber बनेंगे, they should have some competencies, the dormant of competencies we discussed. So उसके हिसाब से he is or she will be capable for prescribing a medication. So competencies, what are the competencies? Number one, clinical reasoning. Yes, very important. While a person is coming to the hospital, he or she will become the patient under you. So clinical thinking, the clinical reasoning, why give this, what is the diagnosis, that thinking should be there. Then second is pharmacological knowledge. Obviously, the nurse prescriber will have this knowledge. हमेशा उसके पास ये proper knowledge होना चाहिए pharmacologically, like the action of the drug, like the doses, the frequency of the drug, the adverse reaction of the drug, the contraindication of the drug. Everything should be very proper. So उसके पास pharmacological knowledge भी होना चाहिए. And communication, yes, so in a very critical area जहाँ पे complex way को आप कैसे simple way में लाकर communicate करोगे ताकि जो person है वो अच्छे से समझ सके वो medication की बात, that is communication skill, that should be there. And next, ethical and the legal judgment. Ethically, legally, the regulatory bodies are there. So based on that, the nurse prescriber that should have the competency about the legal and the ethical ways and continuous professional development. Means we should have the up-to-date knowledge. Knowledge should be according to the evidence-based practice. So the knowledge should be up to date ताकि वो competently उस area में उतर के काम कर सके. So clinical reasoning जहाँ पे evaluating the patient problems, okay, and also differential diagnosis and formulating the therapeutic option. From this medicine, उससे उसका क्या बेनिफिट रहेगा, क्या हार्म रहेगा, that particularly the clinical reasoning should be very important. Pharmacological knowledge already I mentioned about the understanding of the medication, the potential of that medication, the benefit and harm of that medication, the communication skills, the complex information को आप simple तरीके में वो कैसे समझा सकते हैं. And legally and ethically judgment where nurse prescriber हमेशा the regulatory bodies and also the informed consent. हमेशा हम लोग कोई भी प्रोसीजर करने से पहले कंसर्न फॉर्म लेते हैं. क्यों? क्योंकि उससे हाँ आई एम गिवन द नॉलेज, हमको ये नॉलेज मिला है, डॉक्टर ने ये बोला है कि मुझे ये मेडिसिन लेना है एंड आई एम एग्री विद दैट. To inform consent for the further legal aspects and continuous professional development. Where as a nurse we have trained in different ways like अभी नया नया चीजें आया है, so that up to their knowledge we have gained. So likewise our competencies can improve as a nurse practitioner, those who will become as a nurse prescriber. Okay, and there are some factors जो क्या करते हैं, they are influencing towards the prescription. So what are the factors? There are main four areas, that is the patient factor, number one. Next is the system factor, the healthcare system, and the professional factor, and the last one, the commercial factor. So factors में देखा जाए, there are four factors are good. So patient factors में क्या है? The age, already principle में आपने बोला है. So the age of the person, any physiological changes, okay, then any other concern about the post effect. यहाँ पे patient concern आएगा, whether the medicine will be affordable by the patient or not. This also concern. So this is the one of the factors. Suppose बहुत महंगा medicine उसके लिए जरूरत पड़ रहा है, but the person cannot afford that. So this also become a one of the factors related with the patient. Then the system factor means the healthcare system. जहाँ पे हम हैं उस एरिया में उस सिस्टम पे क्या क्या अवेलेबिलिटी होगा. Okay, whether the medicine will be very easily available and it's under the guidance, under the standard treatment guidelines, so all systems के अंदर. So that includes the availability of the standard treatment guidelines, the accessibility of the drug, or if a prescription is going through the electronic way or any other process. So systemic factors, the healthcare system, okay, is also one of the important factors. Now comes the personal factor, that was practice. So already I told competencies, there should be knowledge, skills, so that he or she can come to function on that particular area. So the knowledge, the level of knowledge, the experience, and the familiarity with the certain drug. क्योंकि मुझे मेरा नॉलेज पता है कि कहाँ तक मेरे लिए ये कॉम्पिटेंसी तो है, हेल्थ केयर एज ए हेल्थ केयर प्रोफेशनल इस प्रोसेस में कैसे इन्फ्लुएंस करेगा. Okay, professionally, so we have to be up to date knowledge. And next, commercial factors. Now, already there are many pharma companies. तो क्या करते हैं, अपने ड्रग्स को प्रमोशन करने के लिए they बोलेगा कि we will give some incentives so that if you prescribe our medication, this is also affecting on the irrational prescribe. तो आप जब हॉस्पिटल में जाते होंगे तो देखते होंगे कि बहुत सारा एमआर उधर रहता है. तो मेडिकल फार्मा कंपनी में काम करते हैं और अपना प्रमोशन करते हैं मेडिसिन का, दिस मेडिसिन इज अपडेट और तो इसमें क्या होता है, हमारा थिंकिंग में क्या आता है कि प्रमोशन कर रहा है वो लोग एंड दे आर एंगेजिंग अस टू प्रोडक्ट factors, professional factors are influencing in prescribing effectively. And the last one, step. So according to WHO, they have given 6-step models. So one by one step we have to follow while prescribing the medicine. And that model WHO ने जो मॉडल किया है 6 स्टेप मॉडल्स, उसका मेन एम क्या है कि पेशेंट का मेडिसिन के जो रिसीव करेगा that should be appropriate for their clinical needs, in the right doses, in the adequate period, and also in the affordable form. तो प्रिंसिपल में भी cost effective था, यहाँ पे भी सेम थिंग WHO गाइडलाइंस के थ्रू द मॉडल्स जो दिया गया है we should focus on the right doses and also how much duration, the adequate period, and the affordable cost of the medicine. So see the models one by one. Number one step in that model is define the patient problem. Yes, पहले भी क्या था? We should be very clear about the rationale. So here in the first step also we have to define the patient problem. If this problem से आया है ये, okay, clinically क्या complaints था उसका? So that problem step number one. Number two step is regarding the specific therapeutic objective. ओके, तो थेराप्यूटिक ऑब्जेक्टिव हमेशा हम लोग जब ट्रीटमेंट करते हैं तो कहाँ पे जाते हैं? वी आर लुकिंग टू द थेराप्यूटिक वे, द ट्रीटमेंट, ओके, एंड द फास्ट रिकवरी कि जल्दी से जल्दी ठीक हो जाए. तो ये सेकेंड स्टेप है. फॉर आइडेंटिफिकेशन हो गया. देन इसके बाद नेक्स्ट स्टेप इज द थेराप्यूटिक ऑब्जेक्टिव शुड बी वेरी स्पेसिफिक. Then after next is now choose the standard treatment. The third step अभी हम standard treatment को choose करेंगे. Then उसके साथ साथ after choosing that we have to verify. Okay, verify the drug on the behalf of the doses. Okay, that the frequency, the action, the contraindications. So choose and verify the third step, and in the fourth step that is the after finalizing, after verifying, that is the treatment. Okay, starting the treatment and after starting as well as on the same time continuously we have to give a proper information regarding the doses और कैसा लेना है, warning and interaction. So lastly on the sixth step, now अभी हम medication दे दिया, this last step is monitor. Okay, the same thing is also in the principles. So monitoring, and it's okay, the person is recovered, we can go to the final stage of stopping or otherwise changing the treatment. Okay, if the recovery is not totally satisfied, so monitor and also stop. So the sixth step that is given by the WHO, that model perspective. So while knowing these 6 step models, we understood that हमेशा as a nurse prescriber competency तो रहना जरूरी है, क्योंकि to define the patient problem में we should be gathering the information including the symptoms, okay, that including the medical history, the allergies to any kind of medication, and suppose the person is using over the counter drugs. Means कोई जो प्रिस्क्राइब नहीं करते हैं, तो जैसे कि हम लोगों को बुखार आता है तो हम लोग पैरासिटामोल लेते हैं, तो दिस इज वन एग्जांपल ऑफ द ओवर द काउंटर मेडिकेशन. तो ऐसा कुछ हिस्ट्री है that should be proper to define the patient problem. Next, specify the therapeutic objective. वही जो हमने बताया कि एनी ट्रीटमेंट हम लोग थेराप्यूटिकली डील करते हैं टू रिसीव और टू गोल को पाने के लिए कि फुल रिकवरी हो जाए. So without any specific objective, that is not possible to give a treatment or to start a treatment. And third, already choose and verify the treatment policy. Okay, then number 4 is the starting of the treatment. Number 3 is giving information, instruction and warning. And lastly is monitoring and reviewing the treatment. तो ये जो टॉपिक है स्पेशल इज मॉड्यूल अबाउट द प्रिस्क्रिप्शन प्रिंसिपल्स, कॉम्पिटेंसीज, फैक्टर्स एंड स्टेप्स. This module is related with your fourth semester. In the mandatory module. So to become a nurse prescriber, these models will guide you, these principles will make you very competent to promote a patient safety and quality of care. I am very thankful to RK Institute of Medical Science for giving such kind of opportunity to present this book. Thank you, everyone.
Thank you so much, ma'am, for the enlightful session. And on behalf of the organizing committee, I sincerely thanks to you. And with this, we will formally start our next session after 10 minutes.